On this Tuesday night, 'twas the fight before Christmas. Booming demand for boosters and COVID-19 tests as Omicron overwhelms.
It's so contagious that everyone's going to be exposed in a matter of weeks.
Breaking news from BC as the province beefs up its pandemic protocols. Holiday travel trouble. The new rules and advice for visitors in some provinces.
This variant does not care if we are weary.
From Omicron testing times to treatment options, doctors answer more of your COVID-19 questions. And oh, Christmas tree, the holiday staple suddenly in short supply.
We're going to see the effects of this for years to come.
We'll get to the root of the problem.
Global National with Donna Friesen. Reporting tonight, Jeff Semple.
Good evening and thank you for joining us. We begin again tonight with the rapid rise in COVID-19 cases and restrictions in Canada, driven by that highly transmissible variant Omicron. And it was another record-breaking day. Take a look. Here are the numbers so far, with record case counts reported in BC, Nova Scotia, and Quebec, which topped 5,000 new cases for the first time. Omicron is now the dominant strain in Ontario, which reported more than 3,400 cases, with a test positivity rate of almost 10%. But the key metric we're watching, of course, is hospitalizations. Ontario's Chief Medical Officer of Health said that of the 4,600 Ontarians with confirmed cases of Omicron, a relatively small number, just 15, have been hospitalized.
Even if it's much less virulent, its attack rate could mean that it spreads so rapidly that it will have an effect on our hospital sector.
And this is what he's worried about. Take a look. The fast climbing case numbers, a steeper curve than anything we've seen so far in this pandemic, which risks overwhelming our hospitals once again. Health officials say our best weapon against Omicron is a vaccine booster shot. But already the demand for those boosters and for COVID-19 tests are overwhelming our health systems. Mike Drolet has our top story tonight.
This rec centre wasn't just the hot spot for handing out rapid antigen tests on a frigid Ottawa morning. It was the only spot. The line started at 4 a.m. The bad news came at 7.
Right now they're delayed from Toronto.
With no tests to offer, workers apologized, handed out IOUs, and took their lumps.
This is terrible. Absolutely terrible.
Yeah.
This isn't acceptable. I'm not blaming you.
Thank you for not blaming us.
And it's not their fault. The speed with which Omicron has spread has overwhelmed the system. 2 weeks ago, vaccination clinics were nearly empty. Today, Mississauga residents lined up over 5 hours for the chance to get one of 300 booster shots from a pop-up clinic. And while there were no testing kits available in Ottawa, here they were handed out to those waiting in line.
Just a little bonus, I guess.
Peace of mind, perhaps, but not the definitive or most accurate COVID test. Daniel Baer started to feel ill last Wednesday.
I let my guard down a little bit one time, and I think that was probably all it took.
He twice tested negative before finally confirming he had COVID with 3 successive antigen tests on the weekend. For public health to consider him COVID positive, he needs a PCR test, but the earliest spot he could book was the end of the week.
I don't need a PCR test for vanity's sake. I need a PCR test so that the school can notify other families that I was there for pickup.
Dr. Rewat Dianandan says we better get used to supply issues and delays because Ontario, for one, has said it may have to start rationing PCR tests to keep up with Omicron.
I mean, it's crazy contagious. I've been saying that Delta is the most contagious respiratory virus we'd ever seen in modern times. Omicron leaves Delta in the dust. It's so contagious that everyone's going to be exposed in a matter of weeks, everybody. So you can't test everybody in a matter of weeks.
And that could make the holiday season a little less merry for everyone. Mike Drolet, Global News, Toronto.
To some breaking news out of BC now, where its daily COVID caseload just hit a record-breaking 1,308, a significant jump just from yesterday. Tonight, that province is unveiling tough new restrictions to try to slow the spread of Omicron.
We know that this is a disappointing and discouraging thing to hear at this point in time. People in BC have stepped up. We've done the right thing over and over. But the challenge that we have is this virus doesn't recognize that. What it does, it has changed, and so must we.
Global BC's Legislative Bureau Chief Keith Baldrey joins us now. So Keith, walk us through the main changes here.
Yeah, the changes mean we're really going backwards. We've seen these changes before at different parts of the pandemic. And it also comes on a day when we're setting a near record of 1,308 COVID-19 cases. So closure of bars and clubs that don't have a food license. We're going to see also a ban on gatherings in terms of weddings, funerals, and receptions. Also going to see gyms, fitness centers, and dance studios closed. The goal is to minimize the social gatherings of people in close quarters, particularly in indoor settings. The rule that was announced on Friday will remain in place. A maximum of 10 people added to your household for any social indoor gathering. And finally, again, 6 people at a table is the maximum for restaurants. The restaurants really dodged a bullet here. They were fearing they were going to see crowd capacity limits, such as we're seeing in Ontario and Quebec. That didn't happen today. So the restaurants got a bit of a break today.
Interesting. And Keith, we also heard that BC is ramping up the use of rapid tests. What should we expect there?
Nothing in the short term, lots of them in January. The government's been feeling the heat about the lack of rapid testing out there, but they are going to purchase almost 12 million rapid tests in January, use them in various ways. But the strategy, it doesn't seem to change. It's not going to be a lot of take-home tests. It's going to be targeted testing where they think it's most required, in Indigenous communities, in health-compromised communities, and in places really where you need them.
Keith Baldrey in Victoria, BC tonight. Thanks, Keith. And Alberta is also bringing in some new restrictions as it deals with its own spike in cases. Starting December 24th, venues with a capacity of more than 1,000 people will be capped at 50% capacity. No food or drinks will be allowed at large events, and restaurants will be limited to 10 people per table. The Alberta government is also offering booster shots to all adults 18 and up, effective immediately, as long as it's been more than 5 months since your last shot. Tightening restrictions and surging cases are also further complicating Canadians' holiday travel plans, even for those who are planning to travel within the country. Jamie Mauracher reports on the interprovincial travel rules.
Omicron is quickly becoming the variant that stole Christmas.
It does not care if the holiday season is upon us. It does not care if we have travel plans or if our loved ones from away want to come home for the holidays.
Starting Wednesday, visitors to Prince Edward Island will be met with a mandatory 4-day quarantine. In Newfoundland and Labrador, self-isolation is being enforced for 5 days.
It is really in every province at the moment. And I don't think that interprovincial travel bans at the moment are really likely to accomplish anything incredibly useful.
Even Health Canada isn't discouraging moving around interprovincially yet. Instead, the focus has been on international travel.
I will say it again. Now is not the time to travel.
A stern warning to avoid leaving the country, citing possible changes to travel rules and complications of contracting COVID abroad. Janet Waketz isn't canceling her trip to Florida on Boxing Day, but testing requirements, she says, aren't making it easy.
We've called probably 15 to 20 pharmacies, and while we were able to book at one, they called back and canceled because they said they're all on short staff for Christmas Day.
Appointments in Ontario are becoming harder and harder to get on short notice as Omicron cases surge. And when it comes to testing for non-essential reasons like a trip, Health Canada says people are on their own. Waketz says she'll be missing Christmas, driving 2 hours to a costly private clinic to get hers.
I mean, our kids are adults. It doesn't make it any less guilt-inducing because I'm going to have to abandon them.
A decision she says she's been forced to make just to get away this holiday season. Jamie Mauracher, Global News, Toronto.
In the U.S., the Omicron variant is now the dominant strain of COVID-19, and cases there are also climbing fast. New infections are pushing the country's curve to its highest level since the summer. More than 143,000 cases are now being reported on average every day. That's up 20% from just 2 weeks ago. The first death from Omicron in the U.S. has also now been recorded, a Texas man who was unvaccinated. And today, President Joe Biden announced new measures to take on the new variant. Jackson Proskow has The View from Washington.
Just days before Christmas, long lines for COVID testing are everywhere.
If I'm positive, I will not be going to see family.
The rapid surge in positive cases is unprecedented in the U.S., and there are unusually dire warnings about the ability for hospitals to cope.
Even if only a small proportion are severe, especially in places that don't have vaccination coverage, we are going to be faced with crushing demands on the healthcare system.
Good afternoon, folks.
Against that backdrop, President Joe Biden announced a plan to combat the Omicron variant.
We should all be concerned about Omicron, but not panicked.
Biden plans to distribute 500 million at-home tests. Federal agencies will be tapped to run booster clinics and support hospitals. There was no announcement of new federal restrictions or mandates.
I know some Americans are wondering if you can safely celebrate the holidays with your family and friends. The answer is yes, you can, if you and those you celebrate with are vaccinated.
Yet as Biden encouraged Americans to proceed with their holiday plans, he also acknowledged the possibility of widespread but mild breakthrough infections.
There will be positive cases in every office, even here in the White House.
It's all a stark contrast from the message just 5 months ago.
Today, we're closer than ever to declaring our independence from a deadly virus.
Instead, the U.S. has remained gripped by the pandemic.
We will not comply!
Divided over masks and vaccine mandates, as tens of thousands have needlessly died, and millions more remain unwilling to get vaccinated. There is some potential good news for anyone who might become severely ill during this latest surge. Bloomberg reports that 2 new antiviral treatments designed specifically for COVID-19 could be approved as early as this week. In studies, they've shown to be up to 90% effective at reducing death and hospitalization. Jeff?
Jackson Proskow in Washington. Thanks, Jackson. A new year brings new restrictions in Europe. Coming up, the upcoming rules for anyone who wants to travel freely in the EU. Plus, staggering divorce settlement. The hefty sum Dubai's ruler is being forced to fork out. New Zealand is delaying its border reopening plans due to the spread of Omicron. Quarantine-free travel for Australians will be pushed back from mid-January to the end of February. Foreign tourists won't be allowed into New Zealand until April. New Zealand has reported 22 cases of Omicron, all of those coming in travelers arriving from abroad. The European Union has also announced new travel rules that will make COVID booster shots mandatory to travel freely within the EU without testing or quarantine. The European Commission says the bloc's digital COVID certificate will only be valid for 9 months after a person's second dose. After that, a booster shot is needed to renew the certificate. The new measure still needs to be approved by all EU members, but it's expected to come into effect in February. A British court has ordered the ruler of Dubai to pay his ex-wife and their children more than $900 million. It's one of the most expensive divorce settlements in British history. Sheikh Mohammed bin Rashid Al Maktoum was ordered to pay nearly half of the settlement to his 6th wife and the rest to their 2 daughters. The trio fled to the UK in 2019. The princess sought custody of their 2 kids through British courts, saying she was terrified of her husband. Can the highly contagious variant open a path to herd immunity? We're answering your Omicron questions next. Anyone looking to make a quick cross-border Christmas shopping trip will now require a negative COVID-19 test before returning home. Starting today, the federal government is requiring anyone entering the country to show proof of a negative PCR test. The health minister announced the new rules on Friday, citing the surge in Omicron infections. Before now, travelers re-entering the country after short trips of less than 72 hours were not required to take a test. Well, from testing to treatment, we have received a lot of questions from viewers about the Omicron variant. And to answer some of those now, we are joined by infectious disease expert Dr. Dan Gregson and epidemiologist Dr. Christopher Labos. Thank you, gentlemen, both for joining us. So, Dr. Labos, first to you, and we have a question here from Kevin, who says that he's been in contact with a person who is confirmed positive for Omicron. How long before he might also test positive?
So you probably won't test positive during the first few days of the after the exposure. So day 1 and day 2, you probably won't. But by day 3, 4, and 5, if you are infected, you probably will test positive at that point. And then if you get too far away from the initial exposure after about day 7 or 8, the likelihood of you testing positive starts to drop off again.
Okay, very good to know. Next question comes from Joe with a question about masks. And so, Dr. Gregson, this one to you. Joe sees people wearing face shields with no face masks all the time, wondering how effective these face shields and face masks are against the Omicron variant.
Short answer is they're not. This is a bit of misinformation that face shields are used to prevent transmission of respiratory infections. That's not what happens. We use face shields in addition to masks to reduce the risk of transmission. So they're an added feature. They're not a single feature, so to speak.
Okay. Next question comes from Lori. This one for you, Dr. Labos, asking if there are any treatment options against Omicron, and asking specifically about antibody treatments that are widely available in the United States.
Yeah, so I think this is a common misconception. There are actually multiple treatments for COVID, and there's no reason to think that the treatments for Omicron would be different than they would for all the other variants of COVID. I mean, at its very basics, it's steroids, which were one of the first treatments to be used. There are some antivirals, remdesivir being one. There are the new oral pills that were developed by Merck and by Pfizer, but those aren't really used yet. And there are a number of other treatments as well. The concern has always been that antibody-based treatments might not be as effective because of the differences between Omicron and the original strains. But all this to say in brief, there are actually multiple treatments for COVID that can help speed the recovery of people when they're in hospital. But of course, always much better to not get COVID in the first place. And that's the benefit of vaccines. They actually prevent disease rather than treating you after you get sick.
Right, excellent point, of course. And back over to you, Dr. Gregson. Next question comes from Rod. This is a common question, actually, we've received a lot of, asking about herd immunity. So if Omicron is highly contagious and a large percentage of the population of Canada were to catch it and then recover, would we be able to go back to normal?
So respiratory viruses aren't like some other viruses we see circulating in the environment. So what generally happens is we have a wave of virus come through, we develop immunity. The virus then mutates a little bit. We have another wave of virus come through and we develop immunity. Our current problem is large parts of the population doesn't have immunity, so we're going to use big waves. And that as we more and more develop immunity to just different variants, we'll have fewer and fewer waves and they'll be not as big as time goes by.
Okay, last question to you, Dr. Labos. We're almost out of time, but this one from Jacqueline, who notes with Omicron spreading so rapidly throughout the world, what are your thoughts on the odds of the virus going through another, even more concerning mutation?
Well, it's certainly possible, especially if we don't control COVID globally. If we allow COVID to spread and to be spreading rapidly in various parts of the world, in various countries where vaccine uptake is low, then yes, this could happen again. This is how Delta emerged. This is how Omicron emerged. So unless, once this wave is over, if we don't realize and remember that we need to get vaccines to countries where supply of vaccination is low, this probably will keep happening. So we have to remember that we have to control this virus, not just in Canada, but control it globally.
Thanks for nothing on that last one. Doctors Dan Gregson, Christopher Labos, gentlemen, really appreciate your time. Thanks for tackling these questions for us.
You're welcome. Have a great day.
And we will be putting questions about Omicron straight to the experts all week. So please send us yours to yourquestions@globalnews.ca. Christmas tree troubles. Next, why California's climate has uprooted the supply. Welcome back. It's hard to imagine the holidays without one. The Christmas tree is a centerpiece for many family gatherings, and it's especially festive if you find a real one. But on the U.S. West Coast, Christmas trees are harder to come by this year. Rob Malcolm explains.
Dazzler Farms has long been a staple of the fall season in California, growing pumpkins. And this year, they are also in the Christmas tree business. But with wildfires and unprecedented drought, that transition hasn't been easy. Many West Coast sellers who rely on supply from California and Oregon have had a hard time filling their lots.
They don't have the tree supply like they used to. Between the fires and the drought, the supply just isn't there.
Wildfires in 2020 had already wiped out several Christmas tree farms in California. And with unprecedented drought in 2021, even more farms have struggled, meaning fewer trees overall and that's driven prices up.
Christmas trees have gone way up. I mean, I have a lot of clients that are I'm a real estate agent. They complain all the time about the prices this year. It's getting crazy.
This year alone, the cost of real trees is estimated to be up 20% over last year, and that's on top of the increases already felt over the past few years. While the biggest might be on the price, there's also been an impact on the size of the trees.
Between fires and drought combined, like this year, it was almost impossible to get tall trees.
And in a few years, skyrocketing tree prices and height won't be the only issue. That's because it takes 6 to 10 years to grow a Christmas tree to maturity. And when seedlings have been damaged because of drought and wildfires, the impacts will be felt for years to come. It's not a dying business, but Christmas tree farms like Bobby Dazzler's just outside of Sacramento understand what's at stake, and they say Christmases in the future could look a little bit differently.
We're going to see the effects of this for years to come.
For some consumers, switching Christmas traditions to include an artificial tree might be the answer in the long term. But amid supply chain issues, artificial trees have been in short supply this year too.
Supply and demand, it's on everything.
So this Christmas, real trees may look a little different and cost more. But with droughts and wildfires becoming more prevalent in a state already suffering, there are questions about whether Christmas trees will become harder and harder to come by in the coming years, forcing a switch to artificial for many consumers. Rob Malcolm, Global News, Sacramento.
Sorry, Santa. That is Global National for this Tuesday night. I'm Jeff Semple. Today is the winter solstice, an important event for many cultures, including Canada's Indigenous peoples. So we leave you tonight with these sculptures in Edmonton by Cree artist Jason Carter, marking the longest night of the year. They represent the grandfather sun, the grandmother moon, and Mother Earth, each holding a light to care for us in the darkness. Thanks for watching. Hope to see you back here again tomorrow. Have a great night.